Following New York's COVID-19 vaccine mandate, only about 3% of healthcare workers ended up leaving their jobs or they were put on leave. But for some sectors within the healthcare industry, that percentage was higher. Home healthcare saw the biggest impact with roughly 8% of the workforce leaving. I spoke to a local company about how they're getting creative to help with any staffing shortages. While roughly 20,000 home health care workers have left the industry since the New York vaccine mandate went into effect, staffing shortages began long before this.
There's just been this mass exodus of staffing.
John Hunt is the owner of Caring Hearts of Rochester, a family-owned home care business, and he knows just how difficult it is right now to find help.
We lost 75% of our business due to not being able to have staff.
Like many industries, there's a worker shortage in a healthcare industry during a time when more people are seeking care. Some workers leaving due to concerns over the Delta variant, others to take care of their own families. To help with shortages, Caring Hearts has become one of the first in the country to use a new system called QPath. It's a device that reminds individuals to take their medicine instead of relying on care workers. It then also informs family if medication is missed.
It will come back and spit back the data to the family members and to the people who are involved, case managers, the nurses, their PCPs, and can kind of give them a gauge of when they're taking their meds and when they're not.
Hunt's hopeful while they work to hire more staff, devices like this will help provide care when home care workers can't necessarily be there.
We can go back and we can find out, what's the cause of the reason they're not taking their meds. So as we've had this staff shortage, we've been able to still be in people's homes.
Now, as a reminder, the vaccine mandate for hospitals and nursing home workers went into effect on September 27th. For home health care workers, they had to get their first shot by October 7th.